happens around the groin, the bottom, the breasts, the armpits, and on average it can take 7 years before doctors get the diagnosis right and start the correct treatment. Hi guys, welcome. This video is one of a series of videos looking at the most frequently asked questions I could find online and from my comment section about the health condition Hidradenitis Suppurativa, or HS as it's also known. As you can see, it's a fairly long list, which I think indicates that we need to do a lot more talking about this condition. So my videos will focus on understanding the condition and what causes it, symptoms, and what other conditions could sometimes be confused for hidradenitis suppurativa. A focus on treatments, what works, what doesn't, and what can you do to prevent or reduce the outbreaks if you have this condition. Is it possible to live with it and manage it successfully? If you're one of the many people with questions on this subject, I hope you find this series helpful. Make sure you've turned on the notification bell so that you know when later videos are published. Now, what is hidradenitis suppurativa? People who specialize in treating skin conditions tell us they don't know precisely why hidradenitis suppurativa develops, but we know that it is a long-term recurring skin condition which leads to painful abscesses and scars. It's a complex disease that sometimes looks like the skin is very inflamed with boils, but on other occasions it doesn't appear inflamed and there are lots of scars. And this complexity is part of what makes it challenging to diagnose. And on average, it can take 7 years before doctors get the diagnosis right and begin the correct treatments. It commonly happens around the groin, the bottom, the breasts, the armpits, generally areas where skin is rubbing against skin. Lumps or nodules often develop around hair follicles or sweat glands of the skin. But how does this happen? First, there is a blockage of the sweat glands connected to hair follicles. These sweat glands become inflamed and filled with pus, leading to blockage around the follicle and trapping skin cells, other materials and germs in the area. The next thing is that the follicles swell into lumps that can look like boils. When these burst, they leak pus, causing more inflammation, abscesses, and scars when this happens over and over again. The fact that sweat glands are primarily affected indicates why this condition tends to happen in those parts of the skin where we sweat a lot. The underarms, the genitals and buttocks, the neck, skin folds, and so on. Is HS rare? HS was once considered rare, but is now recognized as more common than what we previously thought. Between 1 to 4 in 1,000 people are thought to be affected with hidradenitis suppurativa. It might even be more than we know because many people are unwilling and embarrassed to discuss this condition. It is 3 times more common in women than in men and associated with some hormone imbalance. For example, in conditions like PCOS or polycystic ovary syndrome, where women may experience excess facial or body hair, ovulation abnormalities, and other symptoms. In women, HS tends to begin around puberty or menarche when a first period is seen. So it could be confused with acne. And this can create a big problem with diagnosis at the very early stages. In 30% of people with HS, there is a family connection, and that's helpful to know for early diagnosis and treatment. It is also a condition that is more common in Black people, Asians, or other groups of non-Caucasian ethnicity. Is it due to having bad hygiene? This is a very common question. HS has nothing to do with bad hygiene and it is not contagious. You can't spread it from one person to the next. Thanks to the location of HS lesions in the genital area, the underarms or under the breasts, HS can make women feel dirty and embarrassed to discuss the problem with their doctors. However, it's got nothing to do with being dirty or not observing proper hygiene. Staying clean, of course, helps to promote overall health, but HS does not happen because women don't wash themselves or are not looking after their genitals properly. Is HS an autoimmune disease? An autoimmune condition is a disease where your immune system attacks healthy cells in your body. This can lead to inflammation and damage of various tissues and organs. There are more than 80 different types of autoimmune diseases, for example, rheumatoid arthritis, lupus, type 1 diabetes, and so on. Earlier, we talked about damage to sweat glands in the skin as a result of inflammation, which is one of the reasons we suspect autoimmune involvement in developing HS. This understanding has also led to recent research demonstrating certain autoimmune agents known as cytokines being involved in HS developing, and therefore the production of new drugs known as biologics that can counter these cytokines. We will discuss more about treatment in later videos. Another good question is HS due to a staph infection or an infection with some other kind of germs? And my best answer for this right now is perhaps. The germs or bacteria that usually live on your skin without causing any problems may become trapped in the blocked sweat gland or hair follicle, as we talked about earlier. We don't know yet whether this is what starts off the disease or it contributes to the inflammation that is already going on. And next, what about the involvement of hormones? Since hormones are involved in the way sweat glands work, this may relate to the inflammation and blockage of the hair follicles, which starts off the disease process in the first place. In women, HS may be worse around your menstrual period, which of course are under the influence of your hormones. A significant aspect of HS is its association with other conditions, such as bowel problems like Crohn's disease or ulcerative colitis. People with HS are also at a higher risk of developing conditions like high cholesterol, high blood pressure, and diabetes. And although these do not specifically cause the problem, checking your blood pressure, cholesterol level, and blood sugar levels is essential if you have HS. There is also a link between smoking, obesity, and HS. And in 3 out of 10 people with HS, there is a family connection, which means that it runs in the family, but it's not contagious. And this is where we'll stop this video looking at what hidradenitis suppurativa is and what causes this condition. I hope you found this review informative. Make sure you come back for the next part looking at the symptoms of HS. One of these, of course, involves boils or lumps in the vulva and the vagina. So if you're interested in learning more about that subject, make sure you check out this video here, and I'll see you again soon.